inflammation is the constant activation of your immune system. This creates what I like to describe as a toxic environment inside your body. What you also may not realize is that your reproductive hormones are tightly tied to your inflammatory system. The toxic environment is going to impact your egg quality, the ability of egg and sperm to meet and for fertilization to occur. It can impact egg and embryo transport through the fallopian tube, implantation, and pregnancy loss. But again, chronic inflammation, chronic stress, constantly activated cortisol, these are not normal things. And this is why lowering inflammation with each thing that you do can make a difference. Welcome back to the As a Woman podcast, where we explore fertility hormones and your formula for health. I'm your host, Dr. Natalie Crawford, and in today's episode, we are talking about something that is often overlooked, but absolutely critical if you're trying to conceive: inflammation. You may have heard that term tossed around, maybe in relation to your gut or your immune system or your diet, but what does it really mean when it comes to your fertility? In this episode, I'm breaking down the real science behind inflammation, how it impacts your eggs, your cycles, and implantation, and what you can actually do to reduce it. If you've ever been told everything looks normal, but you're still not getting pregnant or you feel off, then this episode is for you. Also, we're doing a deep dive on inflammation today, but there's even more information in my new book, The Fertility Formula. So don't forget to go to nataliecrawfordmd.com/book so that you can learn more, as The Fertility Formula is on pre-sale now. When we dive into inflammation, the first thing I want to talk about is what is inflammation and the difference in good versus bad, because you're going to hear this term a lot. One question I get asked all the time is, why can't I just take an anti-inflammatory medication if inflammation is so bad? And we're going to get to covering that. Acute inflammation is a process that is really normal for your body. So when you have acute inflammation, this is your body's normal reaction so that it can heal and it can recover. When we want you to get better from something, so let's say that you cut your hand, your body is going to send out signals and your immune system is going to be activated so that you can heal that cut from your hand. That is normal, and that is actually a very important part of our immune system. That is temporary, shortly activated, and you can recover quickly from acute inflammation. But I like to describe inflammation as a continuum. So your body can go from acute inflammation to chronic inflammation, and then your immune system can even permanently get activated, which is known as autoimmunity. Chronic inflammation is the constant activation of your immune system, and this is toxic to our body. Your body is not supposed to have your immune system constantly turned on. When it happens, this can be in response to the world around you or disease process, and this is probably why you've heard the term inflammation so much. Chronic inflammation absolutely impacts your fertility. And it's so interesting because this is something that I learned in medical school, and then we didn't really talk about it much in residency or fellowship, or even in my first years of practice. It took me really being curious about our body and doing a deep dive into natural fertility and the factors that we can control to really learn about inflammation. And it's not that there's a lack of research. There's actually a significant amount of research talking about the detrimental impact of chronic inflammation on our fertility, our hormones, and our reproductive health. When the immune system is chronically activated, chronic inflammation, this creates what I like to describe as a toxic environment inside your body. And obviously that sounds pretty dangerous. A toxic environment is going to impact your egg quality, the ability of egg and sperm to meet and for fertilization to occur. It can impact egg and embryo transport through the fallopian tube, implantation, and pregnancy loss, in addition to just having huge hormonal changes from inflammation. If we think about your reproductive hormones, what you may not realize is that over the context of a normal cycle, inflammation plays a role. So when we think about ovulation, for example, what is happening? In ovulation, the follicle that grew the egg has gotten to a size where it's very large and the egg inside is mature. Well, you have to get the egg outside the follicle in order to get pregnant. So the follicle is going to rupture, actually opens up, allows the egg to be released, and then the egg can be captured by the fallopian tube. Well, that act of ovulation is actually controlled by inflammation. Your inflammatory system, acute inflammation, is crucial for ovulation. Interestingly, if you take NSAIDs, which is a type of anti-inflammatory medication that we're probably pretty familiar with, Motrin, ibuprofen, Aleve, these medications work by blocking this part of the immune system and preventing acute inflammation. And this can actually prevent ovulation. You might still have some of the hormonal changes. You might still think that you're ovulating, but the egg is not actually being released from the follicle because of the anti-inflammatory medication. And this is why, on a side note, that we tell women who are trying to get pregnant that you should not be taking anti-inflammatory medication, at least not around ovulation. So acute inflammation is important not just in ovulation, but also in the implantation process. What you also may not realize is that your reproductive hormones are tightly tied to your inflammatory system. So for example, estrogen is anti-inflammatory, while progesterone suppresses your immune system, and cortisol is pro-inflammatory. What does this mean? This means that as your egg is growing, estrogen is kind of fighting some of that inflammation so that you're not getting overwhelmed from it. However, if you start to have hormonal change, maybe you're not ovulating as much. Maybe you have PCOS, or maybe you have perimenopause. If you have more low estrogen days, you're going to have more higher inflammatory days. On the other hand, progesterone suppresses our immune system, and this is actually really important for being able to get pregnant. In order for implantation to occur, your body has to allow an embryo to grow into your uterus, which is crazy if you think about it. And in order for that to happen, progesterone is an important role in allowing the implantation window to open and close, but also in allowing the maternal immune system to allow this embryo to invade into the uterine wall. And cortisol is a very interesting one. Most of us know about cortisol when it comes to the stress hormone. Cortisol is pro-inflammatory, and what that means is it's activating your immune system. Why? Well, if we think about what cortisol does, at least what our bodies are meant for it to do, this is a response to an acute stressor. Your body's going to send out cortisol so that your heart rate can be activated, your blood can get pumping, maybe because you have to run away from that bear. This is a time where you might want your immune system activated to fight off anything that's coming around. But again, chronic inflammation, chronic stress, constantly activated cortisol, these are not normal things. So when somebody says that lowering your stress can actually improve your inflammation, they're not just making that up or being some grifter. That's an actual truth because your stress hormones impact inflammation directly. So when it comes to that immune continuum, thinking about acute inflammation being a normal body response, chronic inflammation, that constant activation of the immune system, which can be problematic. If you have constant chronic inflammation, you are setting yourself up for autoimmunity. Now, most people have heard of autoimmune disease, but what you may not know is that the rate of autoimmune disease is increasing significantly. In the past 30 years, there's been a 50% increase in the diagnosis of autoimmune disease. And one of the worst things about autoimmune disease is it can take years to get diagnosed. This is because the symptoms of chronic inflammation are very vague, and it can be really hard to have somebody take you seriously. These symptoms are things like fatigue and headache and brain fog or not being able to concentrate, feeling confused or not having good coordination, having GI distress, being more irritable or depressed. And you can have symptoms like period changes and infertility and pregnancy loss. The list of chronic inflammation symptoms in my book spans for 2 pages, just to give you an idea of how many different things are tied to this chronic immune activation. The problem is if you go to your doctor and you say you have fatigue, very often we're dismissed. And I'm going to give you some tips on how to handle this at the end of the episode. But I want you to realize that having your immune system constantly activated can lead to this autoimmunity. Autoimmune disease is when your body has usually some genetic predisposition, and then there's some environmental trigger. So it's not just getting it from your mom, but also the world that you live in or the state of inflammation that turns this disease on in some people and not in other people. And this should show you that the most important time, in my opinion, is what I call the preclinical phase of autoimmune disease. This is where you might have these constant chronic inflammation symptoms, but nothing is turning positive on lab work. That world where everything is normal. This actually represents an opportunity of time where you can make an intervention in your life, you can change your exposures, And you can start to decrease your risk of developing a true autoimmune disease by reversing the inflammation spectrum. But what about your fertility? Well, if you think about those reproductive hormones like we've talked about in prior episodes, I talked about how the brain is sending out signals to your ovary and to your whole body. I like to think about the brain being that air traffic control center. But chronic inflammation is static on the radio, makes it a lot harder for your brain to interpret the true signals that your body is sending. This can cause your brain to not respond appropriately, to send out the wrong signals, or to just not listen altogether. If you can imagine, we want our brain to be able to properly interpret the signals that our ovaries are giving us. So this is a really big deal. And this is why lowering inflammation with each thing that you do can make a difference, because if you're decreasing the static on that radio, there's a greater chance that the person on the other end, or your brain, can actually interpret what is happening, and then your brain, ovaries, your whole body can respond appropriately. We know that higher systemic levels of inflammation can be associated with irregular periods, specifically longer cycles and longer follicular phase, which means delayed ovulation. You'll have lower pregnancy rates, higher miscarriage rates. And then there's a whole slew of reproductive disorders that are associated with inflammation. Polycystic ovarian syndrome, or PCOS, endometriosis, adenomyosis. These are diseases where inflammation is part of the hallmark of why these diseases can become so problematic. And one of the reasons why IVF is sometimes treatment for things like endometriosis and adenomyosis, because IVF may be the only way we can truly change the environment, because we're taking your eggs out of your body. Because if your body has this constant immune insult and you have this toxic inflammation building up, the only way to overcome that may be to change the environment significantly. So remember that constant immune activation, this chronic inflammation, is really problematic. And that's why I want to empower you with things that you can think about. When it comes to infertility, one thing that I hate is this diagnosis of unexplained infertility. What is unexplained infertility and why does it relate to inflammation? Because in my opinion, unexplained infertility is simply undiagnosed infertility. That's because it's not something that's easy to diagnose. It's not one of the top causes. When we're doing a fertility evaluation, the things that we're looking for include your anatomy, so your uterus and your fallopian tubes. We check to see if you're ovulating. We look at your ovarian reserve, and we check male factors with a semen analysis. If all of those things are normal, yet you're still not getting pregnant, then you have graduated into this unexplained infertility category. I believe that a lot of unexplained infertility is truly due to chronic inflammation or inflammatory diseases. And there's literature to support this because endometriosis can be a top cause. Endometriosis is where your body has endometrial-like tissue outside the uterus. The endometrium is that lining that grows, and it grows in response to estrogen. And then when you have a period every month, you're bleeding off your endometrium. So it's hormonally responsive tissue that's supposed to be just inside your uterus. Well, if you have endometrial-like tissue outside your uterus, when you ovulate or have hormonal changes, estrogen is going to stimulate this tissue as well. Yet your body recognizes that this is not normal. It's not supposed to be in these locations. And your immune system gets activated to fight these endometrial tissue implants. What happens then is this chronic inflammation ensues that gets worse with every single ovulatory cycle that you have. For something like endometriosis, unfortunately, it's only diagnosed with surgery. So it's not something where I can do a blood test or I can know. There are some symptoms that can sometimes be suggestive, and these are typically inflammatory symptoms that revolve around pain. So painful periods, pain with intercourse, pelvic pain in general. But when I think about patients that I see with endometriosis, they often have so many of those chronic inflammatory symptoms as well. Things that we talked about earlier, like the fatigue, the bloating, the brain fog, just not feeling like themselves, especially around times of hormonal highs or lows, because that tissue is responsive to the estrogen and progesterone changes. Endometriosis is just one example of something that can go into this unexplained infertility category that can be tied to inflammation. Well, I always like to talk about a case, and one case could be my own situation. So if you've been here for a while, you may know that I had 4 pregnancy losses before we were able to get pregnant with my 2 kids. And I talk about this really frequently on my channel. I went through the whole evaluation, had pregnancy losses in my last year of residency and early in fellowship, and everything turned out normal. So I got into the lovely unexplained pregnancy loss category. I had doctors tell me it's just bad luck or just keep trying, you're young. I had people dismiss it, saying you're just too stressed because of medical training. And none of that really made me feel like it was the answer. I felt like there was a true cause for why I was experiencing this. Well, when all the testing was normal and I was told just to keep trying, that really set me off on a course to dive deep into natural fertility and to really learn about our body and the world around us. And this is when I really started to learn about how inflammation plays such a crucial role in our ability to get pregnant and to stay pregnant. This, to me, really opened up my life, and I started making big changes to decrease inflammation in my world. Things like throwing out things in our kitchen, plastics and Teflon, changing the way that I ate, trying to remove anything that could cause inflammation, and learning to really listen to my body when it comes to movement and stress and sleep. Dietary changes impact us all differently, but when I got pregnant with my kids, I was eating a very plant-based, whole foods diet, high in fruits and vegetables, and I had cut out dairy and gluten. I have been vegetarian for a while before this, so at that time I wasn't eating any meat. But I did end up getting pregnant right before we did IVF with some lesser aggressive treatment with Clomid. Now, with my 2 kids, they did great and carry on. Although years later, I ended up getting diagnosed with celiac disease. So it turns out that I had an autoimmune disease this entire time, despite being told that everything was normal. And my celiac disease contributed to my own pregnancy losses. And when I cut out gluten in an attempt to have less inflammation in my world, that's because I noticed that gluten made me feel more inflamed. When I looked at those chronic inflammation symptoms, for me personally, when I had gluten, they were worse. So I cut it out. I had no idea that eating gluten during those first 4 pregnancy losses was a major contributor to my inflammatory burden. Was it the sole reason why I lost every pregnancy? Probably not. But did it make it a lot harder? Absolutely. And was I gluten-free with the 2 pregnancies that became my kids? I was, and I didn't even know I had celiac at that time. For me, my recurrent pregnancy loss was my body's red flag. It was telling me that something was wrong. If I had listened to my body earlier and recognized all those signs of chronic inflammation that everybody else just brushed off, I would have been in a position to potentially make change earlier. And that's part of what I want you to be able to do. So for many people, inflammation may be the missing link if you're struggling either with your hormone balance or in your ability to get pregnant. And even when it comes to fertility treatments, things like IVF cannot override just your immune system because we still want you to get pregnant. Your eggs still grow in your body. So every small change that you can make makes a big difference. I often say that your fertility is much more than luck. It's actually the sum of many things, but some of these you can control, but nobody is talking about it. It's up to you to learn about your body and learn what you can do. One huge piece of the puzzle when it comes to inflammation is actually our gut and insulin resistance. So inside our gut, you are constantly eating foods, and this is a direct source where foods that can cause inflammation can have a big role. So if you're eating ultra-processed foods that are highly inflammatory, this is actually going to directly impact your gut. It's going to contribute to having more what we call gut permeability. You may not realize that your gut is lined with this one row of intestinal cells. And in between these cells is supposed to be a barrier. Think of it like a filter, preventing some of these toxins from getting into your bloodstream and allowing just nutrients to be absorbed from your food. Well, the chronic inflammation from food that we eat inside our gut actually can widen the gaps between these cells. And this can be called sometimes a leaky gut. What this means is that our gut is no longer protecting our body from all of this inflammation or from the toxins that we are taking in. So it becomes a direct source where inflammatory foods have a double hit. They are inflammatory on their own, and then they weaken our gut. In addition, insulin resistance plays a big role in inflammation. Insulin is a hormone that your body releases in response to food, and it's an important part of metabolism. However, what happens is as your body starts to develop resistance if you're constantly eating food that is causing a lot of glucose. So things like sugar or highly processed foods or ultra-processed foods. When you constantly have really elevated glucose levels, your body starts to build up a mechanism where it combats this with insulin resistance, meaning it no longer senses the insulin that your body is releasing in response to the glucose. Therefore, that glucose is not able to be utilized by the cells, and that's your cell's favorite way to get energy. And you end up having this higher circulatory glucose or sugar load. This results in inflammation itself because your body is not supposed to be functioning in that way. So when we look at the way that the choices we make when it comes to our diet itself can impact our inflammation, it is multi-layer on how the foods that we are choosing actually can fight or harm our bodies when it comes to our inflammatory burden. On the other hand, having foods that are high in fiber is a big way that we can help heal our gut. Fiber is not in animal foods. So if you're out there eating a steak and chicken and not having any fruits and vegetables on your plate, you probably are not taking enough fiber. And I know that the world right now loves to focus on protein. Protein is an important building block of your body. But if there was one thing that I would have you focus more on, it would be fiber. You need to take in at least 25 grams of fiber a day, and fiber comes mostly from our fruits and our vegetables. Fiber is a way that our body can help heal some of that leaky gut, and fiber is very important inside our intestines as well for our gut microbiome. I know the microbiome becomes this really trendy word that people talk about, but it's actually really, really important in hormone metabolism, specifically in estrogen metabolism. And if your gut microbiome is altered, in addition to not metabolizing estrogen as well, your body also is going to have a harder time getting pregnant, meaning women who had infertility had an altered gut bacteria ratio more than women who did not have infertility. So having foods that are high in fiber, which can help nourish and keep our gut microbiome in a balanced state, in addition to repairing a leaky gut and help fight insulin resistance, is a really crucial thing. So when I tell you, hey, you need to eat a diet high in fruits and vegetables and fiber, it's not just because fruits and vegetables are supposed to be good for you. It's because fruits and vegetables are actually good for you and they're an important piece of the puzzle. Well, what should you do with this information? The top thing I want to say is that if you tell me your body is off, I believe you. You know that your body the best. You know when you feel good and you know when you feel bad. I want you to really start listening to your body and paying attention to when things feel off and what those things are associated with, because you are the one who's able to share and tell your story the best. For those people who've been dismissed by their doctors before, there's a few things I want you to think about. Number one is that you can always find a new physician or a new clinic. If whoever you're seeing is dismissing you or gaslighting you, then get another provider. There's enough physicians out there who will ask the right questions and take you seriously. Number two is going to be to set up the right type of visit. Trying to bring up all your inflammatory symptoms in a really quick 15-minute visit that your PCP may have is probably not the right time to dive into it. You can schedule a problem-specific visit, meaning I have fatigue and I want to schedule an appointment just to talk about this. That is going to set you up for success. Number three is going to be you are the one who knows your story the best. You know what's normal and you know what's abnormal. Don't go into your doctor and not think about how you're going to present the information to them. The first question I ask when I see a patient is I say, what's going on? Why don't you tell me? I want you to think about your story before you sit down at your doctor's office. Think about what was normal, when things changed, what is bothering you, and what it's associated with. That way you can be the one to relay the information well. I can only make decisions based on what you're telling me. I'm not living your life. I'm not in your shoes. So you have to set the stage. And then lastly, no matter what, know what's next. Are you going to get blood work? Is there going to be any testing done? What things should you change? How do you ask your doctor a question? Do you have a follow-up? Know what the next steps are going to be. And you have to accept that sometimes we don't have an answer. That preclinical phase of autoimmune disease means that some of your autoimmune labs are going to be negative. You're not sick enough to flag an antibody positive, and that is so frustrating because you're not feeling well, but your body is healthy enough to try to overcome it. Instead, view that as a good thing because once you've flipped over into an autoimmune disease, there's no going back, and that's a lifelong disease. So view this as an opportunity where you might be at risk for an autoimmune disease later, and you can make a big change now. What kind of blood work or what kind of testing can you do, specifically if you feel like your hormones are off or you're going through infertility. Understanding your cycle and tracking your cycle are always going to be key. This is going to be a way for you to really understand when you're ovulating and to detect some of those subtle signs of cycle changes. Remember that the ovulatory spectrum goes from normal, regular, predictable cycles with a normal follicular and luteal phase to a short luteal phase to a long follicular phase, long cycles, skipping cycles, to no cycles at all. But you have to know when you ovulate to know what is on each side. So pay attention to your cycle. We sometimes can check for systemic inflammation with blood tests, things like a CRP. Now, this is very non-specific, meaning it can tell me if your body's inflamed, but very often, if you tell me you have inflammatory symptoms, I'm going to believe you. When it comes to fertility specifically, I typically am checking for one of the most common autoimmune diseases, and this is going to be thyroid autoimmunity. So we want to make sure that we're checking antibodies. It's also really important that if you have a family history of any autoimmune disease, that you bring this up to your doctor because things do tend to run in families more. Getting to the root cause is not always easy, but we should at least try. This is going to require you and your doctor and can take a really long time, and you might have to make some lifestyle changes before you really know what the answer is. What do I recommend for somebody who is struggling and feeling like they have symptoms of inflammation? Number one, that balanced diet, high in fruits, vegetables, and fiber as the mainstay. Number two, lots of water, rest for your body, and get enough sleep. Number three, manage stress. Remember how we talked about cortisol being pro-inflammatory? You need to take some time to think about how you can reduce stress in your life. And what works for me is not always going to work for you. So you are the one who understands your body the best. Number four, use movement to support your hormones. Don't go for high intensity exercise or overdoing it because that can contribute to stress just as well. So make sure that you are leaning on activity that is going to lower your cortisol levels and build more skeletal muscle. Skeletal muscle is key in combating that insulin resistance. And then you're also going to want to try to remove any endocrine disruptors from your environment. These are toxic chemicals in our world, things like BPA and phthalates and perfluorinated chemicals that you can learn more about. These chemicals cause inflammation directly and can harm our endocrine system as well. All of these factors I go into in more detail in my book, The Fertility Formula, so don't forget to check it out at nataliecrawfordmd.com/book. But most of all, I want you to know that you know your body the best. You're the one who has to walk this journey, and it's up to you to learn what is normal so that you can know what is abnormal. As you can hear in this episode, chronic inflammation plays a big role in our ability to have normal ovulatory cycles, have normal hormones, and to get pregnant. And I don't want you to be in the position that I was in, wondering if making changes to your lifestyle earlier could have prevented some of your infertility or your pregnancy loss. Thank you guys so much for being here. I'm so appreciative of all of your support, and I hope you learned something from this episode. Please feel free to ask questions and follow along. And until next week, thank you, friends. Thank you for listening to the As a Woman podcast. If you're ready to take control of your reproductive health, my new book, The Fertility Formula, is your next step. It's a science-backed guide to understanding your hormones, optimizing your fertility, and owning your reproductive future. You can order your copy and learn more at nataliecrawfordmd.com/book. And as always, follow along at Natalie Crawford MD for even more support. Because knowledge is power, and your health deserves a formula made just for you as a woman.